That was as meaningful to me as bringing a new life into the world because this marriage was not going to survive. And to get them back together and go, hey, now I remember why I liked you in the first place. And they kind of rekindled that spark.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Kathy Gaumer of Regain Functional Medicine and Aesthetics, who is a board-certified OBGYN with over 35 years of experience, specializing in hormone balance, functional wellness, and aesthetic medicine. As the medical director and co-founder of Regain Functional Medicine in Kansas City, she leads a dedicated team delivering personalized care in hormone therapy, sexual wellness treatments, and advanced aesthetic procedures. Her passion for women's health and whole body wellness has earned her national recognition, including being named a 2024 American Heart Association Kansas City Leader of Impact for her work advancing equitable cardiovascular health. Beyond the clinic, Dr. Gaumer is a fierce advocate for survivors of domestic violence. She has proudly served on the board of Newhouse, Kansas City's oldest domestic violence shelter, and has helped raise critical funds and awareness as honorary co-chair of the Imagine a Day Gala. So Dr. Gaumer, welcome and glad to have you here.
Well, thank you, Daniel. I hope I can live up to that introduction. It was lovely. Thank you.
Yes, well, I'd like to dive a little bit deeper into that. I'm curious, how did you first get interested in medicine?
Well, gosh, okay, you're going back a long way. So, obviously, I think I've always been interested in medicine and being a doctor. My mother and father were both physicians. Aunts and uncles were all physicians. So I just kind of come from that background. I was originally born in Cairo, Egypt. And in that culture, I think growing up and being in some professional field was just kind of what was expected of you. So I've always been interested in medicine and specifically in women's health. So I was lucky enough to be able to go to KU Medical School here in Kansas City and then do my OBGYN residency in Wichita, also the KU Med School affiliate there. So just always kind of been what I wanted to do.
So then how did you make that transition over to aesthetics then?
Yeah, that was a little bit of a bigger jump. So I was in my OBGYN career in my private practice in Lawrence, Kansas, which is about 30 minutes away from Kansas City. It's our university town where KU, Kansas University, home of the Jayhawks, have the undergrad. So my practice was there, and a smaller town, of course, you get to know everybody in your community. I feel like I delivered, like half the babies in that town. And so as you and your patient base is getting older, they became very interested in aesthetic treatments and really just came to me and said, hey, would you ever consider learning how to inject Botox or fillers? And I thought, well, my goodness, I operate in people's pelvises all day long and I do these complex surgeries. Surely I can bring this into my practice and learn about it. And that's pretty much how it took off. And I went to have some training, of course. We had national trainers come in to my practice and train with me as well. And then, of course, all your friends and family members are happy to line up for you to practice on them. So that's how aesthetics kind of first came into my life.
Got it. Now, I know that you offer a lot of different types of treatments in your practice, and even in introduction, you do some ones that are maybe not necessarily typically associated with a medical spa,
Mhm.
more of like wellness, women's hormone therapy, sexual health as well. I do want to dive deeper into the women's hormone therapy side. It's
Sure.
something that's starting to get more and more, I guess, well known. I think it's always been around, but just it's getting more and more well known. So when it comes to hormone therapy, or I would assume people know it as hormone replacement therapy, what is hormone replacement therapy and why should women care about it?
Daniel, I cannot thank you enough for asking that question because I think there is so much confusion, misunderstanding, mixed information out there. And going back to kind of where everything fell apart for women's hormone replacement therapy was back in the late 80s and early 90s, and even into the 2000s, where we had a study called the Women's Health Initiative. That was the biggest study to date for hormone replacement therapy in women. And it was a study that was done on a large number of nurses. And the reason they did that is so they knew they would have great follow-up of their patients. The study itself, however, was flawed in that it was the wrong age group of patients. Most of the average age for the patients in that study were in their early 60s. Most women go through menopause in their early 50s. Average age is 51. The hormone replacement therapy combination that the women were given in the study was given orally. Any hormone, particularly estrogen, given orally can stimulate what's called a first pass effect through the liver, which automatically increases the risk of blood clots. So that's another problem. The third was essentially the type of hormone that they were using, right? So the hormones that they were using were Premarin, which is a horse-derived estrogen, and Provera, which is a very highly active synthetic progestin. So it was wrong age group, wrong route of administration, wrong type of hormones. So it's like strike one, two, and three. What we have found out since then is that, yes, the study was flawed, but when we look back, we kind of identified the flaws and now we know how to correct them. So now we know that hormone replacement therapy is perfectly safe and effective in the right age group of women. So those women transitioning through perimenopause into menopause. So we start it earlier. The type of hormone is as important. So we use products that are natural or structurally natural to the body. So estradiol is the most natural to the body. So what we use is an estradiol product that the body recognizes as its own. Also, the same thing with the progesterone. The micronized progesterone that we use, the body recognizes as the same structure that it used to produce from the ovaries when a woman was before the age of menopause. So, right age group, right type of hormone, and given in the right form. So we don't give it orally. The safest approach in my practice, we give it intramuscularly in an injection. But you can have a transdermal patch. You can do creams. You can do even vaginal dosing can be done as well. So we've come a long way, but now we know what not to do, and we've fixed it. And now we know how to give hormone replacement therapy to the right woman to be able to give her the benefit without increasing any of the risk.
Okay. What about pellets as far as the delivery mechanisms? Is that one that you would recommend, not recommend, or is it just one of those that's in there that just it depends on the patient?
I think it depends on a couple of things. We choose to do intramuscular dosing just because it's very customizable, meaning you can get very specific to what the patient's needs are, the symptoms that they're experiencing. You can manage side effects and all of those things. Pellets are great if that's the only option maybe a woman has in her area or where she lives. Maybe she lives, in a rural area where she's far away from her provider and can't get there for other options. So pellets are definitely great in those instances. We're in a larger metropolitan area in Kansas City, and we draw from a lot of the surrounding area. But honestly, we have found that even patients that come to us, Daniel, on pellets, once they kind of hear about our protocol and our program, the majority of them switch off of pellets onto injection, and hardly ever do they switch back. I think they find that they like the way they feel better on the injection rather than the pellets. And the last thing I would say about pellets is that you tend to get a little higher spike in the hormone level because once the pellets are injected into the area, the subcutaneous area, there is a rapid absorption initially, so your hormones tend to spike a little bit at first, and a lot of people may have some unwanted side effects from that.
Got it.
But
And
definitely a great option.
okay, good to know. So for women, is the hormone treatment primarily estrogen? Is it mostly estrogen and then other things, or is it like a mix of things, or is it mostly other things, but estrogen is the only thing that's coming to my mind as far as hormone treatment for women?
Yeah, and you're exactly right. Most of the time when you say hormone replacement therapy, estrogen is what most people are thinking about. But honestly, when a woman is having normal menstrual cycles, her body is producing three different hormones. Estrogen is definitely one of them. Progesterone is the second, but we also have testosterone production as well, and people don't even really talk about that. But a woman does have some natural testosterone production, certainly not at the level of a man's. I mean, that's clearly not what we're after. But in my practice, we do replace for our women all three of those hormones. And we find that replacing all three really allows the body to revert back to functioning the way it did prior to menopause. Now, I'm not saying that I'm going to take somebody in their 60s and make them feel 20 again, but we do tend to see a significant improvement in not only the symptoms that people are coming in complaining about, but also the way their body's functioning, literally at the cellular level. So blood panels tend to improve. People tend to be able to maybe come off or decrease dosages of whether it's blood pressure or blood sugar management, even depression medications. Sometimes we're able to reduce dosing or sometimes even get them off completely. So it's the attitude of if you give the body back what it was making during a younger time, it remembers and it goes back to functioning more efficiently as it did when it was younger.
Okay. So then when it comes to this type of therapy, is it more commonly used when women are experiencing some type of, I'll call it like a deficiency, like headaches or anything like that, and they come in and they get this to treat that? Or is it more of women that are largely okay, but they want to just have a higher quality of life, a higher quality of health, and so they look at this type of treatment?
Yes and yes.
Okay.
We have both. So it depends on the generation. So my generation, I'm 60. And what I find is that kind of my generation and right around that time, wait for symptoms to occur. Like I'm having hot flashes, I'm not sleeping at night due to night sweats. Now I'm fatigued, I'm headachy, I'm moody, all of those things. And so, yes, we do have patients coming in because of those symptoms and they're seeking relief of them. The younger generations, what I found is very preventative. So they're like, gosh, a patient comes in and goes, I know my mom went through menopause at 45, and I want to be able to sail through that time without having to struggle or suffer through those symptoms. And so, could you check my hormone levels now and kind of see where I am? And we certainly do that as well. And we can kind of gauge or at least tell her, hey, this is kind of where you are. Maybe your estrogen level and progesterone level is okay for right now, but over the next few years, here's probably what you're going to expect. If the testosterone level is a little bit low already, because that tends to maybe decrease before we see a full onset of menopause, we can even just replace a little bit of low dose testosterone for that woman to keep her feeling better until obviously she is closer to menopause. But we see all different types of inquiries coming in.
Okay. So you mentioned some of the symptoms that someone that is going through or has gone through menopause, of why they may want to start looking at this treatment. Is there anything else that, like symptoms that they may be experiencing, that they should start seriously looking at this? Or is it going to be kind of like a broad scope, like it can be a whole bunch of different things? Or like, I guess, in what situation should a woman who's going through those symptoms start looking at this treatment?
Well, definitely there is a constellation of symptoms that I would say, most women are experiencing. Now, obviously, every woman is different. Every individual's life is different. What they want out of treatment is different. But the typical constellation of symptoms that we hear are definitely the night sweats, hot flashes, vaginal dryness, painful intercourse, those types of things. But the other things that I think get maybe not as much information talked or isn't talked about as much is that the lack of those hormones really affect every part of our body. So we start to experience bone loss, muscle loss. So anytime you experience those two things, you start to become weaker, your bones become weaker, you start to become a little bit more unbalanced, you're not as stable on your feet, so that increases the risk of falls and osteoporosis as a woman gets older. Um, Obviously, sexual function is a whole nother discussion that we have with our patients, but even more importantly is cardiac protection. What we do know is that if a woman starts hormone replacement therapy as she's transitioning from through perimenopause into menopause, it is cardioprotective. And we are just now kind of circling back to being able to state those things in a forum like this, for example, without being nervous about it. Because after that study I talked to you about, the WHI, it was felt that hormone replacement therapy was maybe a risk factor, like it would increase a woman's risk of heart attack, stroke, blood clots, pulmonary embolus, all of those things. We now know that, like we said, given in the right form, in the right dose to the right aged woman, it actually is protective of the heart. And the leading cause of death in this country for women is heart disease. I know we talk a lot about breast cancer, and I'm sure we might get to a question, but the number one killer of women is heart disease and heart-related disease. So if we can provide a safe approach to hormone replacement therapy for our female patients, that is going to be cardioprotective and bone protective and muscle protective, that is something that is beneficial for a very long time and gives them that quality of life, right? So we're not talking about, oh, I have hot flashes or I wake up a couple of times a night due to night sweats. This is long-term longevity benefit and quality of life.
Okay. Now, when it comes to the quality of the hormones, is this something that consumers should be aware of, or is it just estrogen is estrogen is estrogen, testosterone is testosterone is testosterone, or is there different levels of quality that a consumer needs to be aware of when they're looking at getting this treatment done?
Absolutely. And I would like to say that, testosterone and estradiol, all of that is the same across the board, but unfortunately, that is not true. As you know, and I do take care of male patients as well. We have a very busy hormone and testosterone replacement practice. So this goes for both women's hormone replacement therapy and men's testosterone replacement therapy. There is a lot of online and TV ads that people are getting sent to them. And I always say, be very careful when you're getting things through the mail or through sites that maybe you don't know if they're okay or not, because you may not know exactly what you're getting and the dose may not be exactly what's stated. It may not be as pure of a product. There may be, other things in there that you're not aware of. For us, we use only certified and licensed compounding pharmacies that we have a very close relationship with. So all hormones are not made the same. And for example, there are three types of estrogen. There's estradiol, which we've been talking about, estrone, and estriol. Sometimes when people have creams or troches or things like that put together, they may have a multiple combination of those three. So you just have to know what you're getting. Make sure you're getting it from a licensed provider, and if you're getting it through a pharmacy, because there are pharmacies that are also working with patients, and I think that's great. Just know, do your research a little bit and know that that individual or that pharmacy or that provider is licensed and has good reviews on their websites and things like that. So I would be cautious.
Okay. So then, in what situation should someone start looking at this? Like, if they want to be preventive, is just a good idea in general, just be like, hey, it's good, just get a checkup, see how your hormone levels are. And then if you need more, then you can talk about treatment. But if you're okay, at least you have that knowledge that you're okay. Is that kind of where you would start most people? At least just get checked?
Yeah, absolutely. And the crazy thing, Daniel, is that I'm an OBGYN, right? So that's where my life has been, women's healthcare for 35 years. And I have to tell you that even my own specialty, because this is what I hear from women all the time. Hey, I went to my OBGYN for my annual exam and I asked them to check my hormones, and they wouldn't do it. And they said, oh, we don't need to check them. You're still having periods or whatever. And they go, oh, but I'm having these symptoms. I don't feel great, whatever. And they're like, oh, you're fine. It's a normal part of aging. And so that's not okay. I think there is no reason why we can't check hormone levels like we would anytime you go and you get your cholesterol checked or your thyroid level checked, or any other standard laboratory evaluation. we should be adding that for our both our male and female patients to kind of, like you said, know where you are, because these hormones are very important to your body's normal function. So it is a little bit off-putting that this is a part of what I would consider kind of normal preventative health screening. But yes, I encourage anybody that's coming into our practice, we always say, hey, this is a no pressure environment. If you just want to come in and see where you are right now, we're happy to check your hormone levels, do whatever lab panel we need to evaluate and look at, and then have a conversation and let you know where you are, and then make a plan, a care plan for, hey, you're okay right now, looking great, hormone levels are still good, but based on your family history and your age and kind of where your levels are, you might be, expecting over the next year or two, things might be changing. So yeah, I think it should be something that is part of a normal evaluation, especially as we get older.
Is there a certain age that people should start looking at this more and more seriously, or is it really any age that people should do this?
Well, that is the harder question because family genetics and family history comes into play. But the average age for menopause in this country is 51. And the men don't get off easy either. There's we call it andropause, or the fun name is menopause, because it is a real thing. And so what we find is that we start seeing maybe the slow decline of hormone levels in mid 40s. And then as we transition into the early 50s. So I would say that would be the normal progression of how hormones start to change at midlife. And as people will tell you, they start noticing those depleting hormones at midlife. What happens? Well, you start getting tired, middle of the afternoon. So when you come home, you may not want to go work out. You want to kind of sit on the couch and watch a show and have dinner and go to bed. You start seeing a little midline weight gain. You start seeing all of those, maybe mental changes, anxiety or depression, not sleeping well. So I think almost everybody feels those changes as they get into their mid 40s. They may not recognize them as hormone changes or whatever, but they're feeling that. So that is the normal progression. Now, there are outliers, of course. I have women in their mid 50s, sometimes completely just still having normal and regular periods. So I'm just kind of giving you the most common, scenario.
Yeah. Okay. And let's say that someone is now interested in at least checking out and seeing, is hormone therapy good for them? What is the most important piece of advice you would give to somebody who is now starting to look for a provider? You kind of mentioned like look them up online, look at the reviews. Was there anything else that they should really keep in mind when they're looking for just the best provider for them?
Right. So every area of the country is a little different, right? So there are different regulations in different states. What my advice is wherever you're looking, make sure that that provider is, of course, licensed. They have a great reputation. If they are not willing to have you come in and have a consultation and just kind of get the lay of the land and hear their presentation, I would be concerned about that. I think you always have to feel comfortable with who you're seeing, and because listen, hormones are complicated, and even most doctors find hormones to be complicated. So if you are seeing someone and they can't really explain what they're doing or why they're doing it or what side effects you should be watching for, or have a plan to address those side effects should they come up, and you're asking questions and maybe they're not comfortable in the answers that they're maybe trying to provide, I would say that would be a very big caution sign.
Okay.
Anybody who's working with hormones should be able to have a very comfortable conversation about what they do, how they do it, and their protocols and all of that. So I'm not saying that you know you need to be skeptical or a difficult patient, but if they can explain all to you and seem knowledgeable and confident, I think I would be concerned and maybe try to look for someone else.
Okay. Now, I asked a bunch of questions around the hormone replacement therapy, but what are some of the other questions you hear? I guess not, maybe not questions, but misconceptions or myths that people believe about it. And we kind of talked about this at the very beginning, like that study that kind of threw things off. But what's the
Sure.
common misconceptions you hear from patients about this type of treatment?
The number one thing is hormones are dangerous or hormones cause cancer.
Hmm.
Both in the male on the male side, hormones cause prostate cancer. That has been completely disproven now, and we even have urologists that continue to do testosterone replacement therapy for their male patients even after prostate cancer treatment. So that is on the men's side probably the number one misconception about hormones and its relationship to prostate cancer. The other myth on the men's side is, oh, it causes anger and rage. Well, I mean, if you're using super physiologic levels, that might be the case, but in appropriate clinical levels, that is not the case. You will feel much better, have higher energy, better overall function without having to worry about, turning into this aggressive person. On the female side, it is the same thing. Hormones cause breast cancer. And we actually know, interestingly enough, from that same study, from the Women's Health Initiative study, there were two arms to that study. One arm that had the hormones we talked about, the equine estrogen and the progestin. The other arm were women who have had hysterectomies, and so they were only on the estrogen side of it. They didn't have the progesterone. And interestingly enough, that group of women actually saw a small decline in the incidence of breast cancer. So we now have much more information showing that if you use the right type of estrogen, again, in the right age group, and obviously, if someone has a strong family history of breast cancer in their family, let's say their mom had breast cancer, they have more than two first degree relatives, of course you have to take that into consideration because that does possibly place them at a higher risk. But for the majority of the general population, that it is not going to increase your breast cancer risk. And what I tell them is, listen, in my practice, we see about 800 patients every month come through our two offices. If what we were doing, and I would say 60% of our patients are female. If what we were doing caused an increased risk of breast cancer, we would have a significantly higher number being diagnosed every year because everybody that comes in is on hormones. That's our job. That's what we do. And that's not what we see. Um, so hormones cause cancer. Hormones are bad for you or somehow cause other problems really is the opposite. And so we do a lot of educating in our first few meetings with our patients because we have a whole onboarding process that we do. We see our patients every week for the first month because there's a lot of educating that needs to go and a lot of questions that need to be answered. So we do have in-depth conversations with patients about dispelling some of those myths or fears.
Got it. Now,
Yeah.
Dr. Gaumer, is there a story that really stands out in your mind of maybe a challenging case or a memorable case of a patient that came into your practice and how you were able to ultimately get them a great outcome in the end?
Oh goodness, picking one. I would say one that really stands out is actually a couple. And they came in, they were in probably their mid to late 50s. They'd been married for a long time. All of their kids were now grown and out of the nest. And they were probably on the verge of divorcing and figured that, they stayed together for the kids and they didn't really know that they even liked each other anymore, but they were in counseling and they wanted to come in and try this. We got the woman on hormone replacement therapy, the man on testosterone replacement therapy, worked with them, optimizing their doses, treating other sexual function issues. And by the end of probably the third month or fourth month or so, you have never seen two more happy people. They said, essentially, you have saved our marriage. And, I've delivered thousands of babies, and that is a wonderful miracle. But that was as meaningful to me as bringing a new life into the world because this marriage was not going to survive. And to get them back together and go, hey, now I remember why I liked you in the first place. And they kind of rekindled that spark was really so worthwhile and wonderful. So that's one of the great stories. And I mean, obviously there's many more, but I
That's
know
an
we're,
amazing story, though.
yeah.
An amazing story. Now, I'm curious, Dr. Gaumer, where do you think the future of hormone replacement therapy is going, aesthetics? Like, where do you think the future is going?
Honestly, Daniel, I really think, I've been in the hormone industry in the longevity space for over 10 years now. And of course, in my OB practice for 30 plus. I really think because the newer generations do want to be preventative and they do want to stay healthier longer, and we are living longer. That is a fact. And everybody doesn't want to just live longer, they want a better quality of life as we get into our older years. So I really think that these types of things that are helpful in preventing disease processes, rather than wait for a disease process to occur and take its toll on your body, let's keep you healthier longer so those disease processes never start. Let's keep your weight optimized. Let's keep your hormones optimized. Let's keep all of that optimized so blood pressure and weight and inflammation and all of those don't have a chance to cause problem and disease. So I'm hoping that in the future, hormone management, hormone replacement, testosterone replacement, all of this becomes, I'll say, more mainstream and rather than not considered part of standard medical care. So I'm hoping that's the way that the population will demand it goes in the future. Because right now, it's because it's not considered standard of care, standard of medicine. It's all kind of out of pocket expense for most people. And so that's a little bit of a hardship financially to take on. So I'm hoping that um, the more we do this and the more we find, hey, we're keeping people healthier longer with a better quality of life, insurance companies hopefully will take notice and start deciding like, hey, this is not experimental or outside of normal medical practice, that hopefully it becomes more mainstream.
Okay. Now, with your practice, the Regain Functional Medicine Aesthetics, what's your ultimate long-term vision for the practice?
Well, right now, obviously, we are in two office locations. I'm currently looking at two more locations right now, still in the Kansas City area. But what I guess my dream would be is to train other physicians, maybe in other states. A lot of them are now doing concierge medicine for all sorts of different reasons. And this is something that can be very easily, I guess, mirrored and replicated in another physician's office. And I'm happy to share, training and knowledge and all of that and be a resource. And so I'd love to be able to bring other physicians in, help get them trained, and so they can go back and take this to their community and hopefully get their community healthier and offer this service. So that's kind of my dream is expanding number one, but also helping with training others, both physicians and nurse practitioners, depending on where they are and what state they're in, what's approved.
Fantastic. Well, Dr. Gaumer, I do have one last question for you, but before I ask it, I do want to point people to your website, and I love this website, by the way, ifeelmuchbetter.com. It's amazing URL.
When we decided on that one, I was like, okay, what do we hear from our patients all the time? And one of my nurse practitioners said, everybody comes in saying, oh my gosh, I feel so much better. And I'm like, that's what we need to use, ifeelmuchbetter.com. So hopefully
Amazing.
it's easy to remember.
Oh yeah, I don't know how I can forget, or how anyone could forget it.
Yeah.
So, Dr. Gaumer, last question is, what does beauty mean to you?
Beauty is, gosh, it has so many different connotations, but to me and to what I feel is beautiful is especially being a physician, we treat everything on a cellular level. So beauty to me is getting someone who maybe is not feeling their best, getting them feeling better, getting their bodies functioning in a way that allows them to do the things that maybe they haven't been able to do. And the smile on their face and the happiness and the glow, because We know estrogen not only affects the rest of the body, but affects the skin and the hair. And so that can also give an added glow back to that patient. So all of those things, I think, is my definition of beauty: seeing someone happy, feeling good, standing tall, having their regained confidence, being able to do what they want to do. That's beautiful.
Amazing answer. Well, there you have it, Dr. Gaumer sharing her expertise. So, Dr. Gaumer, where can people contact you in your practice?
So obviously our website is ifeelmuchbetter.com. Our phone number is 913-291-8555, and it's Regain Functional Medicine and Aesthetics.
Awesome. Well, Dr. Gaumer, it was a pleasure having you on. Thank you so much for sharing your knowledge, answering all these questions, and really just expanding the word on the benefits of hormone replacement therapy.
Thank you so much for having me, Daniel. I truly appreciate it, and I'd love to be back anytime.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.